As a small plan, we need to really leverage resources, and so with MCG it really helps us. So some of my favorite ones, guideline modifier. So we have the national guidelines that are really good, they're robust, but as I said, we're a relatively small health plan and we really want to provide services in a different way that's really member-provider focused. And so we need to be able to take those national guidelines and we need to be able to make considerations for the local delivery system, the nuances and the like, and able to add some criteria that will help our team be more efficient in their work. There are times when a guideline, because of some of our contract arrangements, that we always want it to go to a medical director even if the RN or the clinician can get it to approve. So I like that piece a lot. So we leverage that quite a bit. So I think, right now we have site auto auth, so we're just starting to really capitalize on the benefit of that, but it's in part because it's embedded within our provider portal, and so there are some limitations there, but being able to have the provider self-serve with a real-time decision is something that we're aspiring to and moving forward to that. We have the CareWeb QI, so right now we have the behavioral health static guidelines, so that was an intentional strategic move right now because we have delegated out our behavioral health utilization management. So we wanted to be able to leverage the static guidelines to help us monitor their performance, to see how robust their product is. So that's helpful. And then looking at potentially, leveraging the CareWeb QI for that. But everything else we have CareWeb QI for. So we had the inpatient, we still do. We would like to leverage the multiple condition guideline. And so talking with the team and the nurses, they're like, well, how many people actually get admitted to an organization who only have one diagnosis? So by having the multiple condition, it really makes more sense at the beginning that you can actually look at that inpatient stay based on that individual's life experience, their individual circumstances, to help us move through that. So we have the home care guidelines, we have the recovery guidelines. So we as a small plan, we have fewer people. And we have to really be careful about our administrative overhead, and we don't have the ability to spread that as much as large plans. So by leveraging MCG, we're able to maximize the resources we have, so we get a lot of the work from MCG, and then we're able to capitalize and enhance it with our team. Right now we have around 40,000 lives, and we have purchased or leveraged most of the modules, but as I said, it's because it really gives us the ability, there is cost to that, but when you look at the efficiencies that we gain by doing that and leveraging the different tools, it helps us to meet our requirements for National Community Quality Assurance. And because we're in the marketplace, it's a requirement that a health plan is accredited, so you need to follow the different pieces. And so we really, as I say, need to leverage as much as we can with the human capital we have, so that they have job satisfaction and we have great support for our members and providers.